Welcome back. So even the most healthy East Texans can still have health scares, and strokes being one of those silent killers. So May is National Stroke Awareness Month, and joining us this morning is Mari-Carmen Kennedy with Trinity Mother Frances. Good morning.
Good morning. Hi. Good morning.
Good morning. So tell us about the significance of this month.
So this month is just a time that we just make sure that our community knows about stroke, and we try to give them the tools that they can do to decrease their risk for stroke.
Sounds good.
What is a stroke for some that may not know? I mean, I have a good idea, I think, of what it is, but just explain that for us.
Well, a stroke is when a blood clot breaks off and goes up into the vessel of your brain, and it can cause some minimal to major damage.
Okay, so how can you tell if you're having one or about to have one?
Well, you would notice some weakness or numbness on one arm or leg or the other. You may notice a droop in your face. You may notice some clumsiness or dizziness, difficulty speaking.
Got it.
Now, what are some of the side effects? I know it can range from death to some impairment. What are some of the types of impairments, if one does survive a stroke, that people have to deal with or often live with?
Well, if you notice those symptoms, then it's really important that you come to the hospital immediately. We have some treatments there that we can nearly reverse the symptoms of a stroke. If you get to the hospital quickly, we have a short timeline where we can give a medication called TPA, and it actually dissolves the clot in the vessel. We also have intervention that a physician can go in through a minimally invasive procedure and remove that clot from the brain, leaving you with very minimal symptoms, but you have to get to the hospital really quickly.
So before any of this happens, is there any preventative measures that anyone can take?
Yes, about 80% of all strokes are preventable. People with high blood pressure, cholesterol, or diabetes need to really keep a good check on those levels. They need to work real closely with their physician to make sure that their risks are decreased. People with alcohol use or smoking also increases your risk of stroke. And an irregular heartbeat called atrial fibrillation also can cause you to have a stroke. It's just real important that you work closely with your physician to make sure that those things stay under control.
Absolutely.
Wow. Where can we find more information there, through the Mother Frances site or somewhere else on strokes?
There is lots of information that you can look at. The American Heart Association and American Stroke Association website. Mother Frances should have a little, it's so all over the place when you Google.
There you go.
Good friend for all.
Well, thank you so much for joining us. We appreciate it.
Thank you.
Thank you.
Coming up next on Fox 51.